This PowerPoint deals with treating red telangiectasia with the vein Gogh. The vein Gogh is an RF device, uses a small needle for thermal coagulation of these vessels. You can also use the vein Gogh for venous leg tumors, veins of the face, but in this PowerPoint we talk about treating telangiectasia of the legs. Red telangiectasia less than 0.3 millimeters are almost impossible to treat with sclerotherapy unless there is an associated reticular inflow where you can use foam. Options for treating these small vessels are thermal injury using such devices as IPL, RF, or laser. The laser wavelengths for these small veins are in the range of 532 to 590 nanometers or the 940 nanometer laser. The drawbacks of laser and IPL is that they are very expensive. Also, IPL may be difficult to use and there are more problems associated with hypopigmentation. Red telangiectasia are more superficial in the dermis and are associated also with cutaneous venous hypertension like other telangiectasia. The more superficial the vein is in the reticular dermis, the O2 saturation is more. There is less admixture of blood from the capillaries and the venules at this level. Now this is the histology of ohmic thermolysis applied to a small vessel. You can see that there's absence of endothelial cells, fusion of lumen, actual lifting off of the squamous epithelium from the reticular dermis. This also occurs with a laser. Now, this looks severe damage, however, the area of treatment is less than 30 microns, and there's repopulation of the squamous epithelium through migration of cells from the hair follicles and the eccrine sweat glands. So even though this looks like a lot of damage, there is complete healing within about 4 to 6 weeks. In this PowerPoint, we will discuss the use of the vein Gogh with a Bristol needle for telangiectasia of the legs. As you can see on our settings here, we use a 5% power, which is the lowest power setting, which is more than adequate for treating these small telangiectasia. We use 3 pulses, and we use the auto function. Only a gentle pressure is applied, as you will see, and the actual tissue seems to come up into the needle. Now, the Bristol needle is very precise. There would be less injury at the Bristol than if you use the ballet needle. The ballet needle we use on the face, which we'll discuss later. And as mentioned before, we usually never use this device in veins that are greater than 0.3 millimeters because sclerotherapy, if it can be done, is still the great gold standard.
Now, these little red veins we're going to do today with the vein Gogh, the radiofrequency needle, they're too small for laser, too small for a 32 gauge needle. She has a few right here too. First thing we're going to do is a little tumescent subdermal, little tiny stick. This does 2 things. It helps shrink up the vein, also makes it painless. Next thing we're going to do is put a little dermica cream on. The reason we do that is to keep the needle from puckering the skin a little bit more effective. It keeps the puckering away. So we'll show you the procedure here in just a second. This is the Bristol needle. It's insulated except for the very tip. You just gently put the needle in. You can see the vein being ablated with this. Excellent. You make a little puckering, it goes away. It's only like 30 microns in diameter. But this is the only effective way you can get rid of these little red ones. Lasers really don't do very well with this small blood volume, and sclerotherapy is impossible. Okay. Now this is subdermal again, tumescent to this vein. And we're going to take the Bristol needle after we put a little dermic on. with the puckering. You have to be fairly quick because this whole vein will spasm down with the epinephrine. So you can see how we're treating this. It's going away. Looks great. Okay.
Now we use Dermica cream pre and post treatment to minimize post-treatment inflammation. We use the lowest power setting that will cause vessel disappearance. This is usually 5% with the Bristol needle. We use 3 pulses, which mimics an IPL. Now you can actually decrease the pulses to 2. This may do a little less skin damage. All small skin excoriations will gradually resolve. We consider Van Gogh to be the most inexpensive device. We use this on the face with the ballet needle. We only use the Bristol needle on the leg.